Hi, I'm Randy Neiswonger, CEO of Community Hospital. Welcome to this edition of Community Beat. Today I have a very special guest with a very unique skill set. Dr. Katabi, hi.
Hi.
Welcome.
Thank you.
I'm so excited to have you on Community Beat. Can you tell the viewing audience a little bit about yourself and what you do?
Yeah, definitely. Thank you for having me here. Definitely excited to join Powers Health. I'm Abdul Katabi. I'm originally Syrian, and I've been receiving training in pulmonary medicine and interventional pulmonary in the last few years, lastly at the University of Minnesota. Excited to join this area because I see that the community area here, there is a need for interventional pulmonary specialty. Basically, we help patients to breathe better through procedures. The general pulmonologists do a great job in helping patients breathe better with medical management. However, sometimes it comes to the point that the patient needs a procedure to help open up their lungs and breathe better.
This is a very unique service provided in Northwest Indiana. There's no other interventional pulmonologist around.
I'm sure the community will look at this service as a needed service in the area and hopefully help the population of this area instead of traveling to other places. As an interventional pulmonologist, we take care of a wide realm of pulmonary problems, especially advanced emphysema and COPD patients. We take over their care after the general pulmonologist optimize their treatment with medical management. However, some patients, they may need sometimes advanced interventions. The main things that we take care of are the lung nodules, the lung tumors, endobronchial tumors, and if it needs to be biopsied, we have robot in 2 hospitals at Powers Health that we do procedures at. Using the robot, and also we try to biopsy these nodules with minimally invasive fashion in terms of needles, or now we have the technology of cryobiopsy that we use cold probes to biopsy these nodules. Other aspects of interventional pulmonary includes airway tumors, and especially the patients with advanced cancers. We help them breathe better by doing debulking to their tumors and open up their airways. Although in advanced stages of cancers, we don't give up on these patients. We always help them to breathe better and spend more quality time with their families. We also take care of pleural diseases, including resistant pneumothorax. These patients, they spend weeks and weeks and months sometimes in the hospital just waiting for that air leak to stop. However, now we have, with the new technology of valves, we can help placing valves in the area that is leaking air and help the patient to recover faster and get out of the hospital faster.
I think one of the things that you touched upon, which I'm very impressed with, is the newer technologies with valves. You know, we've seen things that keep vessels opened for years and years in our cardiology space, but the valves for the bronchioles or the airways is very impressive, and I think that's something that we really want to continue to advance. And I think, to your point, a lot of folks in Northwest Indiana can benefit from them. I think the advancement in tumor technology that you were talking about and being able to get to those very remote or distance or difficult to biopsy places in the lungs is going to be important. These tumors could be in very difficult locations, and you have the expertise to do that, so thank you for that. And then the last thing that I didn't know, and I appreciate you articulating it, is, you know, those very pesky pneumothoraxes, so your lung's like a balloon almost, right? So it just kind of, when it pops, that's what the pneumothorax is.
Exactly.
Into your pleural, into the space around your lungs.
Exactly.
Right. Yes. So those could be very pesky, or they can happen regularly.
In our specialty, we take care of complex pulmonary problems that usually takes patient extended time to recover from. However, with our interventions, we try to minimize and lower the time that the patient stay in the hospital using these advanced technologies. Definitely, the recovery time from most of our procedures is minimal compared to other specialties. It's just because of the minimally invasive fashion that we use in most of our procedures.
And that's the magic word. Everybody wants to get, and myself included, the minimally invasive procedure, because that, to your point, allows for rapid recovery. So how do patients get in to see you?
We are in contact with the primary care physicians. The COPD patients goes into a journey of breathlessness and keep seeing doctors until they reach out to a general pulmonologist. And then the general pulmonologist see the patient, optimize their medical management, and apply some rehab as well. But sometimes these patients don't improve with all that. So at the end, the patients see me through either primary care physician after optimizing their COPD or through a general pulmonologist. I have also my own clinic that I see patients in Munster, Indiana, and in Hobart. The general pulmonologist would like to send me the patient. They're welcome to, and also the primary care. However, patients can ask directly and get referrals and get appointments available. And we offer also tele-visits, so that make it easier for patients in remote areas. Instead of traveling for the procedure, sometimes I only need to look at the image and decide if the patient is a candidate for a procedure or not. So I look at the image, I talk to the patient on the phone, and sometimes we open camera to interact, and then bring the patient one time to the hospital for a procedure, and then send them back, continue following up as a telehealth. That's an option too.
Oftentimes these patients have mobility limitations, and so to just have it one-stop shop one time, kind of get an introduction virtually, I guess, is beneficial for them as well.
Yes.
Well, I'm excited. This is an exciting time for Powers Health to have you involved. So thank you for choosing us to come here and work with our patients here in Northwest Indiana. It's a valuable service that we're going to provide. I appreciate your time today, Dr. Katabi.
Pleasure is mine. Thank you so much.
And we're going to see you guys next time on Community Beat.